our Health Watch now this morning. September is National Prostate Cancer Awareness Month, and men in their early 30s should really have their eye on their health when it comes to this particular area. And Chris, you're here with an expert to tell us much more.
That's right, Dr. Anthony Oraja. He's here with us. Thanks for being here. Really appreciate that.
Thank you for having me.
So first off, let's talk about some warning signs, perhaps, of the prostate cancer.
Sure. So some things that we look at with prostate cancer is blood in the urine, having difficulty urinating. Other signs can be really related to your whole body, so fatigue, unintentional weight loss. Those are some of the signs that you can look for prostate cancer.
Yeah, you really want to pay attention to those because it's so important to be proactive rather than reactive, right?
Correct.
Now, that can mean a lot in the treatment?
That can mean a lot in treatment, that can mean a lot in outcome. So typically with prostate cancer, it's a very individualized decision as to whether or not you're going to undergo screening. A lot of prostate cancers are very slow growing, and the signs and symptoms develop over a period of time. Some are not, though. And so really the aggressive ones are the ones that you want to look out for and what the screenings are there for. Our current screenings right now is looking at something called a prostate-specific antigen. It's PSA, which can be ordered through your doctor with a discussion about the risks and benefits of doing that screening. But we also have a test at Synergy that looks at your prostate through an MRI. And that gives you a really good in-detail picture of what your prostate looks like and any kind of small signs of a tumor.
Now, a lot of times, with men, especially when they hear about, going to get a checkup, they get a little nervous. Talk about the prep before, a prostate exam. Is it extensive? What should people do?
That's a great question. Yeah, there's always a little bit of hesitancy with doing really anything medical when it comes to, fellow gentlemen. But with a prostate screening, really it's a blood test. The PSA is a blood test. There can be a follow-up physical exam component, and like I mentioned, this imaging may require a little bit of prep, but it's nothing that is extensive, nothing like a night before type of thing. So it's fairly painless, fairly non-invasive.
And how often should people be getting tested?
So it really depends on the individual, what their risk factors are, if they have family members with a history of prostate cancer. Typically around the age of 50 is when that discussion should be had, and it's very individualized with you and your doctor.
And then if people want to get more information on the screenings you're offering, where's the best place they go?
They can go to our website, synergylc.com, and learn about our prostate MRI as well as our whole body MRI, which looks for signs and symptoms of cancer throughout your body.
All right, stuff to keep an eye on. Doctor, thanks a lot for dropping by this morning.
Thanks for having me.
Appreciate that.